Learning disability or a specific developmental disorder. It inhibits with the skills of learning and it is a life disabilities. They are seen in children as well as adults. The impairment may be so subtle that it may go undetected throughout the life. They can interfere with learning basic skills like reading, writing, arithmetic, and reasoning organization. Living with a learning disability can have an ongoing impact on friendships, work, and self-esteem. These students may also experience problems in executive functioning in areas such as organizing, time management, planning, and decision-making in problem-solving. If an individual does not benefit from a regular education program and it is socially disadvantaged, intellectually limited, and shows no evidence for hard sign of any disorder, then that individual is characterized as learning disabled. However, students with learning disability can succeed when they have access to specific instructions and compensatory strategies to help them overcome their difficulties.
Children with learning disabilities are heterogeneous group. These children are diverse group of individuals exhibiting potential difficulties in many different areas. Learning disability may also be mild, moderate, or severe. The natures of this disability affect the brain abilities to receive, to process, to store information, to respond, and to communicate information. They are due to cognitive deficit intrinsic to the individuals and are often unexpected in relation to other cognitive abilities. The characteristic of learning disability due to hyperactivity, disorder of attention, disorder in speech and learning, slow reading rate, problems in understanding and remembering what is read, problems remembering math facts, poor organization and management of time, letter reversal, overlay large handwriting, slow writing rate.
Types of learning disabilities. Dyslexia is a learning disability that affects reading, writing, and understanding. Dyslexia may have trouble decoding words or with phonemic awareness, which is the ability to recognize particular sounds within words. Dysgraphia is a condition in which people have problems putting their thoughts into writing or drawing. It is also characterized by poor handwriting, however, is not the only symptoms. Individuals with dysgraphia have trouble translating their thoughts into writing, whether in spelling, grammar, vocabulary, critical thinking, or memory. Dyscalcula refers to a group of learning disorders that affect mathematical calculation. It is also known as math anxiety. Auditory processing disorder is a hearing problem that affects about 3% to 5% of school-aged children. Kids with this condition can't understand what they hear in the same way other kids do. This is because their ears and brain don't fully coordinate. Language processing disorder is a subset of auditory processing disorder in which an individual has unique difficulties processing spoken language, affecting both receptive and expressive language. Nonverbal learning disabilities refers to a person's incapacity to communicate. It actually refers to a problem deciphering nonverbal behaviors or social cues. NBLD patients have trouble recognizing nonverbal communication such as body language, facial expression, and voice tone.
Learning disabilities are caused by something affecting the development of the brain. These may occur before birth, during birth, or in early childhood. Learning disabilities can be caused by any one of a variety of factors or by a combination. Sometimes the specific cause is not known. Possible causes include the following: family history and genetics. An inherited condition, meaning that certain genes passed from the parents affected the brain development, which increases the risk of a child developing a disorder. Prenatal and neonatal risk. Poor growth in the uterus, exposure to alcohol or drugs before being born, premature birth, and very low birth weight have been linked with learning disabilities. Psychological trauma. Psychological trauma or abuse in early childhood may affect brain development and increase the risk of learning disability. Physical trauma. Head injuries from accidents or nervous system infections might play a role in the development of learning disabilities. Environmental exposure. Exposure to high levels of toxins such as lead or contact with damaging materials like radiation has been linked to an increased risk of learning disabilities.
These are the common treatment for learning with disability: special education services, EIP or individual education plan, therapy, parent learning and skills training, medication, regular checkup, and peer support. Special education services. Special education services can improve learning difficulties, builds on child's strength, and teach helpful strategies to overcome challenges. IAP or Individual Education Plan. The IAP sets learning goals and determines strategies and services to support the child's learning in school. Therapy. Adult and children with learning disabilities can benefit from the support of a therapist. It can be occupational therapist, educational therapist, and speech therapist. Parent learning and skills training. Parent skills training can help parents to understand their child needs and how best to support them. Medications for attention deficit or hyperactivity disorder may improve a child's ability to concentrate in school. Regular checkups. Everyone should have regular medical checkups. It's particularly important for people with learning with disability who often have additional physical health concerns. Peer support. It can be helpful to speak with others who are experiencing similar difficulties. We have 6 interventions for learning with disability. These are resource room, inclusion mainstreaming or full partial, home-based support, bypass interventions, controversial treatments, and other interventions.
5 strategies for learning disability. It is as follows. First, use the chunking technique. Teachers can assist students in the learning process by dividing the lessons into small chunks that are formed with each other. Each block must refer to material from the preceding ones to connect concepts and use repetition. Second, organize visual information. Many students with learning difficulties process information visually. Teachers and parents can use those skills to understand the lessons. For example, after reading a chapter in a book, ask the students to draw a picture that represents what they read. Third, appeal to multiple senses. For children who are visual learners, you can try hanging up pictures and setting up models. For those who prefer audio-based lessons, you can utilize rhyme, chants, and language games. Some kids are kinesthetic learners, those who learn through modeling objects or designs in clay. Tactile teaching involves the sense of touch, such as manipulating materials like blocks to visualize a scene.
Step-by-step procedure, step-by-step way ng pagtuturo. Hindi pa pwedeng right away, present it. Hindi pa pwede sa kanila ang mga normal strategy natin na ginagamit dahil hindi iyon applicable sa kanila. Mas okay sa kanila yung modeling, i-model mo yung kailangan gawin through manipulative objects. Kailangan makita nila at mahawakan yung how to do it. Kung magluluto sila, for example, sa kanilang TLT, hindi po pwedeng sabihin mo lang na ganito ang pag-hit na dito. Kailangan makita nila how to do it properly.
4. Personalize online tutoring. With personalized tutoring, students can ask questions and receive feedback that meets their specific needs. Online professionals are trained in adapting their approaches to students with learning disabilities. Despite the sessions taking place on the computer, children can still use text chat, write on a virtual whiteboard, and share their screen and record lessons to review later. 5th, include mnemonics. Mnemonics are techniques that help students understand and organize the information they have read through visual and audio cues. They usually rely on the use of keywords, rhymes, and acronyms.
Papaturo. Pagpigtapit tayo nung hindi ko alam sa akin. Dahil hindi ako marunong magbasa. Ano mo puti. Pagbutihan nyo. Magbasa para matuto kayo.